I'm Mary Lloyd Ireland, and I was honored to be asked to speak at the Houston Society meeting. My talk was on ACL reconstruction and return to play. This is my website, marylloydireland.com. I have nothing to disclose. During this talk, we'll go through prevention mechanisms. Injury prevention for ACL tears is really simple as ABC, right? So this injury prevention does correlate well with our return to play. We want them to land in a safe way. So these ABCs are agility, balance, core, strength. The position of no return, it has been thought of by Hewitt and popularized to be knee valgus. And from the frontal plane, it is valgus, but not from the sagittal plane. So I think this position of no return is more of a valgus collapse, but actually more of a functional pivot shift, where the femur rotates first internally and then externally. So when we look at this position of no return from the side or sagittal plane, the knee position is less flexion. There's anterior subluxation of the tibia, and the hamstrings can't work as effectively. And the hip internally rotates and then externally rotates. When the hip internally rotates, it's an adduction, so it's a quick whip action before the ACL tears. This is a mechanism injury. This individual is just taking the ball out of bounds, not really concentrating, not thinking. So as you watch her, she's out of her cone of stability, twists, and boom, there goes her ACL. She's not really thinking about, it's not a jumping activity. She just does what she's done many, many times. And sooner or later, some of these are not preventable, so she tears her ACL. See how she's off balance, her trunk goes to the same side as she tore her right ACL. And her legs are out of the cone of being underneath her pelvis. How do we teach athletes to land in a safe position? The position of safety is shown in this diagram in the lower left. Basically, muscles can act at a better mechanical advantage with certain flexion of the hip and the knee. So in the safe position, the back should be without any lordosis. The hip should be more flexed in a neutral abduction, adduction, and neutral rotation, and the knees more flexed. What this allows the muscles to do is be more effective or agonistic about prevention of injury, with the extensors, abductors, gluteal more effective because of the hip position, and the hamstrings, a two-joint muscle, more effective because of the flexion at the hip and at the knee. When we go down and look at the knee, it should be a neutral rotation, landing on both feet, balanced, and this gives the gastroc and posterior tib a better ability to function. On the right is the position of no return, which is what we want to have these athletes avoid. Here is where the ACL probably tears. It's already torn here when the knee looks ugly. So this position of no return, the body is forward, rotated to the opposite side. The hip is adducted and internally rotated. Less knee flexion, valgus position. And even though the ACL is under more tension in internal rotation, most of our landing basketball injuries show the tibia to be in external rotation, landing on one foot, out of control and unbalanced. So the hip femur goes internally on a fixed externally rotated tibia, and then very quickly, kind of like a whip action, 70 milliseconds, the ACL tears. So if we can get athletes to avoid that position, which we can't in all cases, but that is the goal with prevention of ACL injuries. ACL injuries occur valgus, rotation, out of control movement. Takes 70 milliseconds to tear the ACL. So this is like our cone of stability. In her case, she's too far out, so her leg is not underneath her pelvis. She can't control that. So this is the cone of instability, which could be called the cone of stability if you land correctly. And this is her injury. She's now had 3 ACL tears of the same knee. The typical thing that happens when somebody tears their ACL is they do put their knee to their chest, kind of like the heart attack of the knee, if you will. So that's a non-contact ACL injury. Valgus rotation, out of control movement, a functional pivot shift. The cone of knee stability, if we can keep our pelvis and foot in one cone, so to speak, no injuries occur. When they're out of that cone, that's when the injuries occur.
The cone of silence. I am deeply concerned about the conference room.
What?
I got the concept of cone of stability from the cone of silence. Some of you may remember Get Smart in his cone of silence. So landing is everything. If we can land, eliminate gravity, as our astronauts on the moon, no ACLs occur. Teach athletes how to land in a safe position, fewer ACL injuries will occur. This is my website, MaryLloydIreland.com. Please visit it. There are presentations such as this one narrated on the website. Also publications, travel, other links. Thank you very much from Lexington, Kentucky, the University of Kentucky Medical Center. These are our references.